I know you've all seen this stuff before, but we thought this would be a good review now that we're in the episode to sort of review this and to think about it a little bit differently, and we're more than happy to entertain your questions, as the way Shelley said. So the first slide talks about clinical foundations. This is version 1, includes patients ages 6 to 17 without any behavioral health comorbid conditions. And as you see, over on the left, talks about level 1, the first stage, which is 4 to 6 physician visits a year, medication treatment, and parent-teacher administered behavioral support. And there's a footnote on the bottom. If you look over to the right side, you'll see what's not indicated by evidence-based guidelines. And again, these episodes really focus on evidence-based guidelines to improve quality of care. Looking down a little bit lower is this level 2 for ADHD. Again, that's with no behavioral health comorbid conditions, but a suboptimal response to medication. And in this level, there are 6 physician visits a year, medication again, the same parent-teacher administered behavioral support, with the addition of psychosocial therapy if needed. I want to point your attention to that black box over on the right-hand side that says, all services currently billable to each payer will continue to be billable. Recommended treatment will only be utilized in setting benchmark prices. It's very important and key to this in terms of it's business as usual, but in terms of the benchmark, that's the recommended evidence-based treatment. Okay, if we go on to the next slide, this is more about the approach. So again, there are 2 patient severity levels for ADHD for patients ages 6 to 17 without any behavioral health comorbid conditions. Those with patients with a positive response to medication management and patients for whom response to medication management is inadequate and therefore psychosocial interventions are medically indicated. A separate set of cost thresholds would be, but actually have been established for both levels of severity based upon treatment guidelines, literature, historical costs in Arkansas, and will differ by payer, and we'll get into that further on in this webinar. All patients new to treatment would begin in level 1 care, which would mean psychostimulant medication and parent-teacher administrative behavior support. For patients with an adequate response to level 1 care, provider certification of suboptimal response to guideline concordant care would be required to increase to level 2 care, which is psychostimulant medication or non-stimulant medication and limited psychosocial therapy. Provider submits certification through user-friendly online provider portal, which is no longer a new tool, but it's still a tool for providers to submit certifications and clinical information. This is, I think, a familiar diagram that you've all seen before, which sort of walks through the episode. So first there's an assessment of a new patient, which then would trigger a quality assessment certification, which we'll look at next. And then in the level 1 episode, again, it's ADHD only, no behavioral health comorbid conditions, and a positive response to medication treatment, or it's still actively being titrated. And again, on the bottom, you see the treatment is 4 to 6 physician visits, stimulant medication, and the parent-teacher behavioral intervention. And then this would then go, if the person does well, then the next thing they don't go well. Let me back up, please. On to number C, the severity certification would be what is needed to enter a level 2 episode, which again would be the patients included, ADHD only, no comorbid conditions, but an inadequate response to medication treatment or other possible complications. And the treatment is a few more physician visits a year, medication, parent-teacher involvement, and then the psychosocial treatment that we talked about before. And you can see that at the bottom of those in the dark blue with the light white lettering, the price for level 1 is payer specific, and the price for level 2 is also payer specific. And we'll get into that more specifically in another webinar. Next slide.
Good afternoon. This is Anita Castleberry. I will be going over the certification points for care within this ADHD episode. There are 3 key points in the care when the certification is required. The first is the quality assessment certification that all new patients to your organization will need to be certified for. Those quality assessments should be completed after the assessment to initiate the treatment and should be completed by the provider who will deliver the care. I recall from earlier days that 90% of the ADHD patients do not change providers. So we'll focus on that 90%. If someone comes in and you assess them, then the assumption would be that you would need to certify them to ensure that you get them enrolled and get credit for serving them. It does require providers to certify the completion of guideline concordant components of the assessment. It encourages thoughtful and high-quality assessment and diagnosis, and it encourages appropriate diagnosis of comorbid conditions. Again, the ADHD episode is for those who are diagnosed strictly ADHD. If comorbid conditions are diagnosed, then those would drop out of the episode. Providers also need to be aware of and know how to do continuing care certifications. Those are for all recurring ADHD patients who are already within the episode model. They should be completed at episode recurrence every 12 months because ADHD is a 12-month episode, and completed by the provider who intends to continue care. It requires providers to certify adherence with basic quality of care measures and with guideline concordant care. And it also encourages regular reevaluation of the patient and management at the physician level. The third key point in care where a certification may be needed is the severity certification. And this needs to be performed for all ADHD patients who escalate to level 2 care, whether it's during this very first ADHD episode that we're in right now, or whether it's during a recurring episode. It's completed by the provider who intends to deliver the level 2 care. So one example of that may be that there is a patient who has been seen by their primary care physician and has already taken done the guideline concordant medication trial and maybe isn't doing so well on that. So it's determined that they should be referred to an RSPMI or other provider for level 2 care, which would enable that beneficiary to be able to go ahead and get those psychoeducational services that appear to be needed.